some some noise in the background there.
Sorry, it's my
It's like,
dog.
oh,
I'll
it's a
kick him
happy
out.
dog. I was like,
Come
okay,
on, dude.
that's okay. For all those folks that are out there, just a heads up. This week we're expecting. Well, today we're expecting to hear from the premier, the plan to loosen restrictions across the province when it comes to COVID-19, and our new reality. Will still require physical distancing and proper hand hygiene. That is until a vaccine is found. In the meantime, CSFS continues its work to help people using innovative tools like telehealth. And for more, I'm joined by Dr. Jaya Bastedo. And good morning to you.
Good morning.
So what's work been like for you over the past few months?
So it's been good. It's definitely been different. So normally I spend at least 2 days a week in community, but in an effort not to bring any unwanted viruses or anything to community, we've been staying away.
Mm-hmm.
So I have been seeing patients and community members via telehealth.
Mm.
So I've still been doing full work days, but working a lot on the phone and then doing video calls with people as well to their homes.
And which communities do you serve?
So right now I'm seeing mostly Tatchet and Fort Babine, and then some WFN and Wayoni and Burns Lake area as
Right.
well.
Now you mentioned telehealth. For those who do not know, how does telehealth work?
Yeah, so it's pretty cool. Basically, what happens is people are calling in to our office assistants and to book an appointment as usual. But then the office assistant, if the person has Wi-Fi at home and has a capability, like has an iPad or a phone or computer, anything like that, then we will send them a link, and the program that we're using these days is called Zoom. So the office assistant sends the patient a link, and then basically they just have to click on that link and download the Zoom app. And at the time of the appointment, basically I will be able to click on the link as well, and then we have a video chat just like this.
Right. And how are patients or people adapting to the new reality of using things like telehealth?
I think pretty well. I mean, we're pretty lucky in the Carrier-Secani communities in that we had been using telehealth before coronavirus started. So a lot of people are pretty used to the idea of being able to see us on a video call and comfortable with that as having an appointment. The thing that's pretty new for people and is a bit of a struggle always with technology is figuring it out, without the help of someone else there. So we're connecting to people right in their homes. And yeah, technology can be challenging,
Right.
but we've gotten pretty good at troubleshooting, I think. So
I was thinking
being
about some
able
of
to
my earlier Zoom calls with our in-laws, for example, where we were trying to set up, and half the Zoom calls basically talking about, "Can you see me? Can you hear me? Are we good?" You know, kind of thing.
Yeah.
But people, I'm sure, are adapting.
Oh, you're frozen there.
Back then compared to with how it's being used today. Is it we're seeing pretty much all cases now be using telehealth? Are we having it all? Are any doctors now at all still doing face to face? Like how does that look?
Yeah, so that there aren't any except for up in Takla. So there, Dr. Todd has been up in Takla a lot the past little while. So if there is a patient up in Takla that really needs to be seen in person, like really needs a physical exam, Dr. Todd has been seeing them. But beyond that, none of the other CSFS physicians have been going to community.
Mm.
So for me, in the case of Fort Babine and Tatchet, I'm relying on other healthcare providers if people need a physical exam or need to be seen. So there's a nurse practitioner from Burns Lake who's been going to Grand Isle near Tatchet every once in a while. So I've been able to refer a couple people to her. But yeah, we're just really trying to limit in-person visits to limit that contact and risk of spreading infection.
Right. When is telehealth not ideal? So I'm sure it's being used really innovatively in a lot of different ways. because you can see the patient, they can see you.
Mm-hmm.
But again, in some cases, when might it not be ideal when someone's at home thinking about, hey, maybe I should call for a doctor or not?
Yeah, so I think in a like in a an emergency where you would need to be calling the ambulance, like if there was, someone's having a seizure, something like that, I think the priority should be to call 911,
Hmm.
because we're obviously not physically there to administer medications or help out with a physical presence.
Mm-hmm.
But I do think like once even in a situation like that, telehealth can be helpful,
Hmm.
as long as it's not taking away from the physical support of the person there.
Hmm. I was thinking about, we've come a long way since teleconferencing. When you're using telehealth, it gives you an added advantage because you actually see the person. But also, I imagine there's that something comforting about actually being able to see somebody, see your doctor face to face. No.
Yeah, yeah. And it's really nice for us as doctors too to be able to see our patients.
Hmm.
Yeah.
Now, part of this, we're going to hear later today from the premier about what the restrictions will look like in the days, the months ahead. Things are looking pretty good now. We've had like about 8 cases total confirmed across the province, but there's still a lot of practices that we have to keep in mind going forward until a vaccine is found. Why is hand washing the best method of combating the virus?
Yeah, so hand washing is super important. The virus gets into our bodies through our either our mouth, our nose, our eyes, those places. And often, so the virus can live on surfaces for a certain amount of time. And so, if you're touching a door handle, anything like that, and if the virus is on that door handle, then now it's on your hand. And
Mm,
then if you touch your face, then it can, you can infect yourself. So, but hand washing with soap or alcohol can actually destroy the virus. And so every time we wash our hands, it's sort of a new clean slate,
right?
you know,
Yeah. Until you
yeah,
touch another door handle.
until you touch another door handle, exactly.
So that's,
Yeah.
I guess the thing is, not only is it good to make sure you wash your hands long enough, but the frequency throughout the day is important.
Yeah, exactly. So I suggest people wash their hands definitely every time before they're eating, anytime they come into the house after being outside, obviously after using the
Mm,
washroom, and then honestly, just whenever you think about it or you feel like you've touched something dirty. So say you, I don't know, had a package arrive from the mail, you pick up the package, that package has been touched by somebody else. And so it makes sense to wash your hands after you're
right.
done dealing with the package.
No, my wife's a nurse, so she's been really on it. And like strategic hand sanitizer in the car, by the door, all those
Yeah.
things as much as possible. So imagine that's. But I see a lot of people wearing gloves, right? So if you have to go in public, is wearing gloves effective, and how might it not be effective?
Yeah. So the thing with gloves is they are effective if you're using them appropriately. So if you're using gloves and you're not touching your face when you're wearing those gloves, then that can be helpful. But I would still suggest washing, you still need to wash your hands as soon as you take those gloves off, and then at all of those other steps too. So like the door handle, or like putting sanitizer by the door, and then after the bathroom, all of that, you would need to be washing the
Right,
gloves. The virus can definitely stay on the gloves as well.
right. Now, one thing I think people always think about protecting themselves, but I guess a lot of it also has to come down to protecting others and also containing the spread, correct?
Yeah,
Yep.
yeah, that's mhm.
Right. Now, a reminder to those who are tuning in that we, of course, are here talking about COVID-19. We're talking about telehealth, hand sanitizing. So we are posting, we're inviting listeners or viewers. If you'd like to ask a question, you can post them directly below in the comments below. Jordan, who's on our team, he asked, should we be sanitizing our groceries after coming home from shopping? And if we do, how do we do so?
Yeah, so that's an interesting question. I know that there are some people that are sanitizing their groceries. I think that washing anything that is, so like fruits and vegetables, like anything that the actual food is being touched by other people in the grocery store, I think that makes sense to wash, either washing with soap or water, or there are certain there's like fruit soaps and those kinds of things. Soap
Hmm.
and water is probably the best thing when possible. Some people are, washing the cans and the boxes, like cereal boxes, all of that. I think it's a tough call. If you have the time and the resources, I think that would be helpful. But I think just washing your hands after you are touching those things and then going to prepare the food is probably the most efficient and the thing that I would say is more important.
And try not to do what like I just did, touching my face is one, right?
Exactly. Yeah. 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 Try not to touch your face while you're cooking,
Uh,
limit the amount that you're tasting it and then putting the spoon back in and yeah.
I've been trying to look at like things as almost like scaling them as being high risk, low risk. For example, like we do wipe down our groceries. Again, my wife's a nurse, so she's got a process. But then I look at like say for example, pumping gas. To me, that feels like a very like a higher risk because so I have a whole thing. Like, do you see it kind of the same way? Like, well, yeah, there's a risk, but I don't know if it's that high. But there's others where hey, touching that the pin pad on the gas machine where everyone's using it all day, that to me seems like a higher risk. No.
Yeah, absolutely. So I think it can be pretty overwhelming if you're thinking about sanitizing absolutely everything. And so thinking about the things that have been touched by the most people. So yeah, that ATM machine, the gas pump, the debit machine, if you're actually having to touch the pin pads, the grocery carts. I know that they're being sanitized regularly, but I think that we need to take responsibility for our own hand hygiene in
Mm-hmm.
that situation. And yeah.
And if things are relaxed today, somewhat in the province, like what message do you tell people going forward and keeping safe? And again, I'm making people understand that yes, we are still in the pandemic.
Yeah, so I think we will probably see a relaxation of measures in the near future, and I think that will likely come with opening up sort of more essential things like there may start like more elective surgeries and
Mm-hmm.
more things related to healthcare. But I think that's keeping the amount of people that you're seeing still quite limited, still doing the 2 meters social distancing, keeping up with the hand hygiene will still remain very important basically until we get a vaccine.
Yeah. Have you seen some, would you say, good practices that we should just keep doing anyway? Like, I noticed like that, I think there's a culture of changing. I think I've said before to other people, I don't think I'm going to shake hands ever again, honestly. Do you see some things kind of staying the same and hopefully the same because they're just good habits?
Yeah, I think things like shaking hands with like absolutely everyone you see. I think that I think that not doing that, I think that will stay and remain a good thing to do. I'm hopeful that like the sanitization of surfaces in public areas, like gas stations and grocery stores, and all of that will remain as just a general good practice. I'm hopeful that we'll be able to start, hug people in our really close circles
That'd be nice.
soon. But I think still limiting, just being more conscious about infectious risk when we're spending time with other people.
Hmm.
And I think it'll be a long time before like large gatherings will be.
Yeah.
Yeah.
I mean, this is going to be really helpful in the fall because we're going to see flu season, right? Like that's coming. That will
Yeah.
happen, right?
Yeah.
I mean,
Yeah.
that's all the questions I have. And someone says, Hedy, singing in from Vancouver, say, hello, Cindy. So Cindy says hello from over there. I do invite you, if you don't mind, we do invite people to ask further questions on the comment string below. And then if we can get those answers, answers to those questions later, that'd be great. So this will be saved and posted on our Facebook page. So if anyone has any other further questions about COVID, about hand washing, about telehealth as well, please post in the comments below and we'll do our best to answer them the best as we can. Thank you. Thank you very much for joining me today.
Yeah, no problem. Can I just add one more thing about
Absolutely.
telehealth?
Yep.
So Carrier Sekani, we're available 9 to 4:30 every day, well, Monday to Friday. But then there's a new program through the First Nations Health Authority called the Virtual Doctor of the Day. And so this is a program, it's actually BC wide. So there's a physician available for all of First Nations communities. And people can call in. So the number to call in for that, and maybe we can post this,
Yeah, you
is
bet.
1-855-344-3800. And that service is available 7 days a week, 8:30 to 5.
Okay, great.
So yeah, especially for the County communities. I mean, we it's probably best to see your own physician during the week. But if there's a need, if you wanted to connect with somebody over the weekend, this service can be really helpful.
Wonderful. So yeah, we will
Mhm.
post that information in our comments below. And we'll also post the COVID helpline as well for people that may be presenting symptoms and other resources as well. Thank you so much for joining us today, Dr. Bastedo.
Yeah, no problem. Thank you so much.
And we'll chat again.
Sounds good.
Take care.
Okay, bye.